Hello and welcome to the Army Doctor. I'm Dr. Major Namita and I'm on a mission to take health to every single household. Today on the show, we have Dr. Richa. She's a gynecologist and has an experience of working both in India and UK. Hi Richa, welcome to the show.
Thank you for having me here.
Richa is also a very dear friend and will be able to talk freely. So it is very common that we discuss what is it that we need to talk about with the public and what is it that needs importance. So we were discussing this and she came up with cervical cancer, which is a very important topic to discuss, especially because she has worked in UK and India. We'll be able to compare the numbers for the two. It is very unfortunate that in 2023, 3.4 lakh cases of cervical cancer were detected in India. I think that is a very big number and it should not have happened because a large number leads to mortality. In UK has been able to reduce its cervical cancer incidence. वो incidence में आता ही नहीं है, cancer होता ही नहीं है by 99.8% simply by screening. So what is so different between the two places is what we will discuss today. We will also discuss cervical cancer, which is a very preventable cancer. Why are we not able to control it and catch it in the beginning itself? So, Dr. Richa, before we begin, I would like you to tell us what is cervical cancer?
So, cervical cancer is a cancer which happens on the neck of the womb. बच्चेदानी के मुंह पे जो कैंसर होता है, that's called cervical cancer. And out of all the cancers we know, we found why it happens. And we found that it happens because of a virus. The virus is called human papilloma virus or HPV. So, if we can prevent the infection from this virus or decrease the how long this infection stays, we can effect or catch this cancer before it becomes a cancer in the precancerous stage, which is actually a long time, 10 decades. We can prevent and catch it before it ever becomes a cancer, because once it becomes a cancer, it's very difficult to treat, and more often than not, by the time we get the patients, by the time their symptoms appear, they've already crossed the stage where the treatment is effective.
And it is more debilitating to have the cancer than to prevent it. And
Yes.
what happens when the cancer actually you find that the cancer has actually happened already?
So when the patient starts getting the symptoms, it can be bleeding or discharge or bleeding after sex or bleeding in between sex, and then they come to the hospital, and then we find cancer. It tells you that the cancer is already grown to a certain extent. We may not be able to completely cure it, but in earlier stages, what we can do, very early stages, we can still offer surgery. Surgery is complex. It's a big surgery, but it can be done, and we have cancer surgeons who can effectively do this complex surgeries. If it comes a little later, then surgery doesn't remain an option anymore, और फिर हमें उसको रेडियोथेरेपी या कीमोथेरेपी विद रेडियोथेरेपी के कॉम्बिनेशन से ट्रीट करना पड़ता है. And that we have tertiary care centers, we have facilities to give radiotherapy and chemotherapy, but even that is not a guarantee कि 100% cure achieve होगा. In fact, 75% of all cancers that are detected in India are detected at a stage which ends up in mortality. And even if it doesn't end up in mortality, it has huge implications for financial and emotional impact that it has. Ek to cancer is such a taboo word. Once you hear cancer, it causes an emotional reaction in the family members, yourself, and some people just give up. Second, the impact, sirf radiotherapy, chemotherapy, going from your village, leaving your place of work, going to a bigger place, hiring a room, staying there, leaving your job, not getting the income, all of this has such a huge impact on अगर आप गवर्नमेंट और अफोर्डेबल हेल्थ केयर सेटअप में भी जाते हैं तो भी द कॉस्ट एक्चुअली एंड्स अप टू बी सच अ ह्यूज अमाउंट कि इट आई हैव सीन पीपल हु हैड टू सेल देयर लैंड्स to sell their flats. And I think cancer as a disease can be so financially draining on a family that even upper middle class, low middle class families, leave aside the lower middle class lower class, cannot really afford a cancer treatment.
It's very
So not
sad.
just mortality,
Hmm.
it's the financial and emotional impact it has. And
Hmm.
it is even more sad because it was so easily preventable. You can prevent it from being cancer.
सो पूरी फैमिली अफेक्ट हो जाती है कैंसर से एंड हाउ इट इज़ फाइनेंशियली एंड इमोशनली ड्रेनिंग एंड द इंटायर सिस्टम गेट्स डिस्टर्ब. बच्चे स्कूल जा रहे हैं तो कोई है नहीं उनको स्कूल ले जाने के लिए.
I
इट
know.
कैन बी इट कैन बी एनी सच थिंग. So, prevention is definitely better than cure. Cervical cancer can be prevented. And today, let's talk about prevention more than the cure actually. So, what is it that you can prevent this cancer and how?
देखो, प्रिवेंशन में दो स्ट्रैटेजीज हैं. एक है वैक्सीनेशन और दूसरा है स्क्रीनिंग.
Right.
वैक्सीनेशन है वैक्सीन्स देना, सो दैट एचपीवी इन्फेक्शन जब यंग गर्ल्स या यंग बॉयज को हो तो वो बहुत देर तक पले ना बॉडी में. योर बॉडी क्लियर्स इट वेरी क्विकली, जैसे कि कॉमन कोल्ड को बॉडी निकाल देती है. एंड स्क्रीनिंग इज गायनिकोलॉजिस्ट या हेल्थ केयर सिस्टम, यूके में ये नर्सेस भी करते हैं, बट एक हेल्थ केयर सिस्टम्स के पास जाके इंटरनल एग्जामिनेशन से सर्विक्स से स्वॉब लेना और उस स्वॉब को टेस्ट करना इन्फेक्शन, एचपीवी इन्फेक्शन के लिए और सर्वाइकल सेल्स के लिए. सो देर इज वैक्सीनेशन एंड देर इज स्क्रीनिंग एंड वी कैन टॉक अबाउट देम one by one. Yeah.
So let's pick up screening first. If I go to my doctor, I think there'll be a few things that come to my mind, and a lot of patients have come to me and to you with the same questions. So, first, how painful is it? How uncomfortable is it? Can I go to work the next day? And how frequently should I get it done?
Okay. And I'll add one question to it. Why screening? So
Perfect.
let me start with why screening. So when you have this infection, HPV infection, most of us people will just clear this virus from our body and it'll disappear and no problems. And it's a virus which happens like in 38 to 40% of people, not just sexual but close physical contact as well. So but in small percentage of people where this virus lingers and your body doesn't clear it immediately, and this can happen in completely healthy individual, of this a small percentage of people will develop, their cells will change in a manner which will be precancerous. And then some of these precancerous people will become cancers. But this precancerous stage is very long. It's around 10 to 15 years, Namita. So this is a huge long window of opportunity. And if we pick up, and patient has no symptoms, so they won't come to you. But if we pick up a patient here, if we diagnose a precancerous stage here, then one, it never becomes cancer. And second, treatment is so easy and so small that it has minimum financial implication. And healthcare, most of us, you don't need like advanced chemotherapy, cancer centers. It can be dealt with at a very grassroots levels. So, and now your question, is it uncomfortable? Uh, I know that this is, lot of people are worried about this part. When I asked my mother to come in for screening, it took me, I think, a year to convince her to come to my clinic and get the screening test, because they are more than the examination is the anticipation of the examination.
Okay.
So it is correct that it's an internal examination. It is correct that we'll do an internal examination, look at the cervix, and it is correct it's not very comfortable. But majority, overwhelming majority of people find that it's uncomfortable but not painful. And
Okay.
you are in charge of that examination. So at any point of time, if you feel you're feeling uncomfortable, you want to stop for a while, you want to slow down for a while, you can let your doctor know and they can wait, or you can have a family member hold your hand when it's happening. So it's uncomfortable, but very few people find it difficult to go through it. So it's more the anticipation, it's more the apprehension of getting it done that's the problem rather than the examination itself.
So true. I
Yeah.
think if somebody has a gynecologist like you who can explain it that it is more in the mind than actually So there is no, it's uncomfortable, but still not as much as you're thinking about it. I think everybody should have a gynecologist like you.
Thank you, thank you. So also, it's not just the discomfort part. I think there's a social taboo attached with it,
Okay.
that you don't want to go to a gynecologist. Why should you go to a gynecologist when you don't have symptoms?
Right.
And for screening, you have to come before the symptoms. So there is a taboo not just in the female's mind. You're embarrassed, but there's also a taboo because it's an internal examination, and there is a taboo from your family members. सासों को लगता है कि हमने तो नहीं कराया, तुम्हें क्या ज़रूरत है. So the whole awareness needs to change. People need to be aware कि ये है. Once they are aware of how impactful it is, because like you said, 99.8% reduction in cancer cases in UK, and I've only seen cancer cases, and I work in a cancer team, that the only cancer patients that have been detected are the patients who are immigrants, who've not really been screened from beforehand, because people who being screened, they're usually detected at precancerous stage. So the awareness needs to be there, social taboo needs to go. And then you talked about interval, how often. There is no, different countries have different standards, but our government of India, government of healthcare and family ministry has said that at least from age of 30 to 65, if possible, you should have examination done every 5 years, or at least three examinations from 30 years to 65 years. So one every 10 years. This is the minimum possible. How often is it done in UK where I'm working now? From age of 25, we do it every 3 years. And from age of 50 to 60, it's done every 5 years. So I think it depends upon your personal interaction with healthcare. But I think we need to take a responsibility for ourselves and go to a gynecologist, and go there every so often. Every 5 years seems to be a good compromise. So every 5 years of cervical screening. What is this screening? Like I said, we test for the infection, we test for the cells. If it's negative, then you just wait for your next testing in 5 years. If it's positive, your gynecologist can take you through about what the next step is. But don't be scared. Just being positive does not mean it's cancer, but it means something can be done to prevent this cancer.
So true.
And yeah, and we were talking about this new thing which has come in, and you told me about it, and I was very happy to see that there's a company in India which has started the self-testing cervical smear screening.
True.
So there was a pilot project in Sweden, and they found that they mailed this swab to women at home, and these women took their own vaginal samples
Yeah.
and then tested it for this virus, and they found that the uh, results they got were quite good. They were
Okay.
almost equivalent to the screening sample. And now we have a company in India which has started this self-testing cervical screening system, where you can buy this kit. And I think we researched, and it said it was around 2,500 rupees.
Which is
You
not a
can,
lot. Yeah.
yes, and you can do a vaginal swab. Uh, Put this swab inside the vagina. You don't have to very deep, but it has a list of instructions, and you take this swab and then send it off to be testing. The best is go to a gynecologist, but or a healthcare worker who can do it properly. But if you can't do that, if you're unable to overcome your own apprehensions and taboos, then it's a good alternative.
I
A
think,
self-testing kit.
yeah, the first step is to understand how important it is. That screening is very, very important. Prevention is like way more important. And the first hitch, if you get your screening done once or twice from your gynecologist, that hitch goes away and you're comfortable. It's about taking that step for the first time. The first step is
Yeah.
always most difficult. That is the inertia that we need to overcome. Yeah, so screening part was like explained absolutely in an amazing manner. Now I think I would like to talk about vaccination, because I have two children, a son who's 14 years old and my daughter is 10, and we got both of them vaccinated for HPV last year. And I want you to talk about how important it is to get your children vaccinated, and what all advantages it can have?
So I'd say it's very important to get vaccinated if you can afford it, and it's being rolled out in our national immunization program. So HPV vaccine is a vaccine which is targeted at young children, like from 9 to 14 years of age. And it does not prevent you from getting the infection, this vaccine, but it prevents the amount of time this virus lingers in your body. It decreases that time,
Okay.
and it hopefully prevents this infection from ever leading to a cancer. So, and we've seen results in Sweden where we think that over the last 10 years of study that they have studied, the age group that they've studied, they say that approximately 90% reduction in the number of cancer cases were found in the patients who had the vaccination 10 years ago.
In
So
children, as
in
children.
children.
Yeah.
So it's a study which will give us ongoing results because vaccination is relatively new. So we'll know how it affects women when they grow into adults, 45 and 65 years of age, when the cervical cancer actually peaks. So it's a great idea. I think it's almost necessary to vaccinate your children, both girls and boys, against HPV infection. Girls because it prevents cervical cancer, boys because one, it reduces the general prevalence of HPV infection and benefit the girls in the society, and second, it prevents their own future. It prevents penile cancer, anal cancer, throat cancer, esophageal cancer. So it protects them against other kinds of cancer, which HPV can also cause. So both girls and boys should be vaccinated against HPV. And should children who missed this opportunity and they are more than 15 years of age, or they have just crossed the line where the national immunization program will cover them, should they still get vaccination? I think yes, there's ample evidence to suggest then you can still go for vaccination between 15 to 45 years of age. Even if you have to go private and get a vaccination done, I suggest do that, because like you said, prevention is better than the cure, and the results are very, very promising. So I'm hoping that this would lead to a major impact on the number of cancer cases that we've seen. But it's important to know that you still have to get cervical screening done. Even if you have HPV vaccination, you may still have reduced number of cancer patients, but still some cancer cases can be detected. So you still need to enroll yourself and get your screening done regularly. Vaccination does not mean you do not need screening.
So true. I think to some extent, here cervical cancer we say is preventable, but to some extent, the other types of cancers that you named in boys can also be preventable if they take this vaccine, which is a very interesting takeaway from today's discussion. But let's say if somebody has already crossed that age of vaccination screening, somebody of the age of like around 45 comes to you and not symptomatic, or so what is the minimum number of times, be it 30, be it 45, be it 50, what is the minimum number of times that a woman should have the screening? Like what is that basic number that you would like to give to the audience?
Yeah, I think after 45, or the effect of vaccination would be less and less the older you get.
Yeah.
So closer to 45, I wouldn't say there's a lot of impact that the vaccine would have.
Okay.
But you can still have screening. The screening can go on till 65 years of age,
Yeah.
as long as they were all negative. If they were positive or some abnormality was detected, then a little bit more till it becomes negative. But you can still have screening after 45. And like Government of India has suggested, they have that at least 3 examinations
True.
between 30 to 65. So at least three, at least a decade apart. Hopefully, I mean, so three at 30, 40, 50. And it's never too late. If you want to start at 45, start now. My mother started at 45. So start when you can, and try to be regular once you've started. I'd suggest every 5 years. But if you miss the boat, 10 years is fine. Whenever you can, whenever you remember, go back to the gynecologist. But minimum three times is what Government of India suggests.
Okay. So we have talked about that most of the cases are negative and it's just fine. You wait for the next screening after 3 years, 5 years. What if the examination result is positive? What happens then?
So, if your screening shows that you have this HPV infection, or there are cells that are showing changes which are pre-malignant, pre-cancerous, then um, then it's graded into, is it low risk pre-malignant, is it high risk pre-malignant, or is it moderate risk pre-malignant, and then your gynecologist can discuss, or the cancer doctor, gyne oncologist can discuss with you the strategies. Some of these strategies could be as simple as, and it would depend upon if you're still waiting for family to be completed, are you still planning for kids? And then sometimes these solutions could be as simple as doing yearly tests to make sure it's not going up but disappearing. Sometimes it could be taking a biopsy from the cervix, a small pinch of tissue to test it under a microscope to be absolutely sure.
Okay.
Or sometimes it could be to cut off a part of cervix which looks cancerous,
Right.
and ensuring that all of it has been taken away. Sometimes it could be a bigger surgery like removing the womb. So it would depend, it needs to be personalized, and it would depend upon what was detected and what are the personal circumstances of that patient and
Okay.
what would they like to do. If they want no surveillance at all, you can have the womb taken out
Okay.
if it's higher grade and you don't want any surveillance in the future. But if you're happy to have surveillance, you can have a smaller procedure and then surveillance every year till it disappears. So this is something which is more tailor made and needs a discussion with your gynecologist or a gyne oncologist
It's
and
a very
whoever you.
personal
Yes, there's
opinion,
no, yeah, there is no perfect tailor made answer to this question because it will depend upon
the individual.
various, yeah.
Okay. So I think what I've understood from a lot of information that you've already provided us with is first, most important, that cervical cancer is preventable. And we should start thinking about it from the age group of 9 years and till 65. So from 9 to the age of 15, we vaccinate. From probably 25 to 65, if I'm right. So you go for the screening test, and even if you're vaccinated, you don't skip the screening process, because here in this case prevention is, it's golden, and it is way better than having the problem there and then finding a cure or a solution or treating it with chemotherapy or radiotherapy. Do we need to add anything else to it, Dr. Richa?
No, I think you've summarized it well. I tell my patients that think of it as a pension plan, that you have to you have to keep small amount of monies aside from the beginning when you start working. You cannot be thinking about your pension when you're already about to retire. So similarly, in cervical cancer, and it's a huge risk. It's one in every 56 women will have cancer, have a lifetime risk of cancer in India. So from the moment you reach 30, start putting money aside for your pension plan. Start getting cervical screening done so that you never have to worry about the pension or the cervical cancer when the peaks happen. And like we discussed, peaks happen at 45 and 65. So very young women are affected. Somebody dying, a family member dying at 45 is heartbreaking and has huge financial implications.
Thank you so much, Dr. Richa, or I should just say Richa, for coming to the show, talking about it, increasing the awareness, because it is so important. Thank you so much.
Thank you. It was a pleasure.